Have you ever heard the word subluxation? I'm Dr. Gigi, and this is your 1% better tip of the day. So subluxation, or misalignment, you might have heard us use that word, is when the segments of your spine are not moving properly. And that can happen whether from a big injury that you might have had, you fell, car accident, something like that, or it happens over time with repetitive motions, or if you're really not moving your spine a lot, which happens a lot of times when in older patients as well, that we see that that stagnant type of lifestyle will cause areas that are not going to be moving in your spine. So when that happens, when we have that restricted motion, when the vertebrae are stuck, then we start developing muscle spasm or tension around that joint area with our muscles because our body's trying to protect it. And if that's there long enough, then we start getting inflammation. And that's a natural response that the body has whenever we have that restricted motion in the joint, and it will cause inflammation and swelling in that area. And that's where we start really having that pain, the burning sensations, the sharp pains, and it can even radiate down the legs or arms. That's what we feel when we have that the inflammation in that joint. So at this point now with inflammation, that will irritate the nerve. It will basically start damaging the nerves, and it will dysfunction. And depending where that nerve is going, because our brain sends signals down our spinal cord and out through the nerves, depending where that nerve goes, we will not have that clear communication. So if it's going to the heart, guess what? The heart is not going to work properly. And over time, we start seeing more and more dysfunction. So if that is left and nothing happens and we don't do anything, this is when we start building up degeneration in those joint areas, and basically the structure of that joint is starting to break down. So we don't want to get to that point. That's why we see kids and families in our office all the time. We even see newborns, and a lot of people ask, why do you see them? They don't have pain and they shouldn't be seen. But guess what? That's how fast and how soon we can have those restrictive motions in the spine, which then will lead to this cascade of issues. And if that's left there long enough, in years and decades, then we start getting that degeneration and that breakdown of the spine, and then it's a lot harder to deal with. So we want to make sure that we get ahead of that and start getting those adjustments and making sure that our spine is working as it should be and should be moving as it should be. So one last thing to close off, the great thing, and to just kind of put it all together, is subluxation. At its core, what it means is sub, which is less than, and the lux means light. So it's less light. So basically, once we have subluxation, we have that dimming of the lights. Our nervous system, which is our lights, our power, is actually dimmed down. So we don't want that. So make sure you're getting your adjustments.